Let's talk about the healing after we get the meniscal injuries. So once we get the meniscal injuries, we have a torn border of the meniscus with a cavity inside. So within the cavity, the hematoma will form, means the blood will come in the cavity and it will form a hematoma. Then the inflammation will set in, the multiple neutrophil cells will come, and then they will form, these things will form the fibrin rich glue. So between the two borders, so we have the fibrin rich clot with the multiple neutrophils. Now the new blood vessels will start forming within the cavity. This is called neoangiogenesis. So the inflammation will set in. They will form the hematoma and the fibrin rich glue, and then the new angiogenesis is happening. Then there are the multiple mesenchymal stem cells which will differentiate and proliferate. So the differentiated mesenchymal stem cells will proliferate and they will form the fibrovascular glue, which will glue the two torn borders of the meniscus, and ultimately will lead to the fibrocartilage formation. So this is how the meniscus healing takes place, and this entire place usually takes place between 2 to 3 weeks. So we keep the patient immobilized for at least 3 weeks if we want to conserve meniscal tear, because this is the process that will involve around 3 weeks. So this was about the meniscus healing. Thank you guys. Thank you very much.